people, namaste. Welcome back to my channel. In this video, I will discuss about the terrorism topic. What is the terrorism topic from ophthalmology? From the lesson of diseases of conjunctiva. Okay, terrorism is an important topic for university exams generally, and it is also an important clinical examination questions. In this video, I will discuss about the terrorism. What is the definition of terrorism? Terrorism, it is a wing-shaped fold of conjunctiva encroaching upon the cornea from either side within the interpalpable fissure. How we remember? Generally, it is a wing-shaped where of conjunctiva, fold of conjunctiva, wing-shaped fold of conjunctiva, which is encroaching coming up to the cornea from either side, any side, or nasal side or lateral side or medial side, from either side within the interpalpebral fissure. In the interpalpebral fissure, this is a terrorism definition. Very important. The definition is very important. In every uh, in every practical examination, they will ask what is define the terrorism. So you should remember that it is a wing shaped part of conjunctiva, part or fold. It is a wing shaped fold of conjunctiva encroaching over the cornea, okay, from either side. Is it in the interpalpable fissure? Next, we should know the etiology. Generally, it is not known. Most common in hot climates and who works out like sunlight exposure, dry heat, high winds, abundance of dust, or any radiations also. The person who are working and working having exposing of radiations. This is the etiology for causing of this wing-shaped fold of conjunctiva and crossing the cornea on either side within the interpalpebral fissure. This is the etiology of this terrorism. Next, we should discuss about the pathology. Pathology is degenerative or hyperplastic conditions of conjunctiva. Generally, why this terrorism occurs? This is the degenerative and hyperplastic condition of conjunctiva. Conjunctiva undergoes degenerative and hyperplastic. How it undergoes degenerative and hyperplastic? See, when there is a subconjunctival tissue, it undergoes elastic degeneration. When the conjunctiva below the conjunctiva, subconjunctival tissue undergoes elastic degeneration. When there is no elastic degeneration, because of elastic degeneration under the conjunctival epithelium, there is fibrovascular proliferation will occur. Because of subconjunctival tissue having the subconjunctival tissue having elastic degeneration, because of this, under the conjunctiva, it undergoes fibrovascular proliferation. Because of fibrovascular proliferation, it enroaches upon the cornea. Because of this fibrovascular proliferation under the conjunctival epithelium leads to enroaching the cornea. So this enroaching cornea up to where epithelium, it involves mainly epithelium of cornea and Bowman's layer of cornea and superficial stroma. This is the corneal tissue destruction. So this part undergoes destruction of corneal tissue undergoes destruction because of this conjunctival flap, wing-shaped conjunctival flap. See, subconjunctival tissue undergoes elastic degeneration. Because of this elastic degeneration, the below layer of the conjunctiva, means underneath the conjunctival epithelium, undergoes fibrovascular proliferation. This fibrovascular proliferation enroaches the cornea. Up to which parts of cornea? Up to the epithelium and its Bowman's layer and superficial stroma. It undergoes destruction because of this proliferation, fibrovascular proliferation. Next, we should discuss about the clinical features. Clinical features are age. Generally, we can see old age, generally male, because they are outdoor workers, and it is bilateral, unilateral, and more important, it is commonly present on nasal side than temporal side. Symptoms. How we can know the symptoms? They are cosmetic intolerance. And they having a foreign body sensation like irritation. They have something will be present on the eye. They think it's called foreign body sensation. Then they have a defective vision. Defective vision is called corneal enroaches because it fibrovascular proliferation enroaching the pupillary area. So I have a defective vision called defective vision. It leads to corneal astigmatism, fibrosis in astigmatism leads to fibrosis in the regressive stage. it undergoes regressive stages. Fibrosis in regressive stages. In regressive means last stage, it undergoes fibrosis. Because of this, what is it? When enlarging the pupil, it reaches the pupil, it undergoes blurring of vision, means defective vision. Defective vision leads to corneal astigmatism in later stages. In regressive stages, it leads to fibrosis. Next, we can see diplopia, two types of vision due to limitation of ocular movements. No ocular movements or limitation occurs. No, not limitation of ocular movements leads to diplopia. So these are the very very important symptoms. So you should remember the symptoms. First one is cosmetic intolerance. Next, foreign body sensation. When the case came, you should ask the patient if there is any foreign body sensation to them, they have any defective in vision, they have any diplopia conditions. Diplopia occurs due to limited ocular movements. Why there is defective vision means when it encroaching the pupillar area, it leads to corneal astigmatism. In regressive stages, it leads to fibrosis. So these are the symptoms. It's for our symptoms. Next signs are triangular fold of conjunctiva. We can see the triangular fold of conjunctiva which enroaches the cornea, usually on the nasal side. Typical presentation may occurs on temporal side also. If both are present, it's called double pterygium, primary double pterygium. So first sign is triangular fold of conjunctiva. Next we can see this other sign called Stocker's line. What is Stocker's? Stocker's line is deposition of iron. Deposition of iron is called Stocker's line, seen in corneal epithelium anterior to advancing head of pterygium. Generally, this Stocker's line seen in the corneal epithelium of cornea, where and anterior to advancing the head of pterygium. When there is a head of pterygium, like triangular, no, head anterior to the head of pterygium. This Stocker's line is present at the anterior to the head of pterygium, present on the corneal epithelium. Stocker's line means deposition of iron. These are the two signs present in this pterygium. First one is triangular fold of conjunctiva. Next one is Stocker's line. Next we should discuss about the parts of pterygium. Kinds of head, neck, body, cap. Head, neck, body, cap. What is head? Apical part of cornea. See, from this is the cornea. Here it enters triangular shape. No, this is apical part and cornea is called head. So it is, see, Stocker's line is anterior to the advancing head of pterygium. Anterior to it, it is called Stocker's line. So apical part of on cornea is known as head. Neck is a constricted part present in the limbal area. This is the limbal area. This is a small constricted part present in the limbal area. Next, body is scleral part. Around this is the sclera. So this is the scleral part. Scleral part is body. Next, cap is semilunar, which infiltrates present just in front of the head. Just in front of the head is semilunar, which infiltrates present just in front of the head is called cap. So it consists of four parts like head, neck, cap and body. Head is the present on apex of the cornea, apical part of cornea. Neck is constricted part present on the limbal area. Cap is just in front of the head. Body is scleral part. These are the four parts present in the pterygium. Next we should discuss about the types of pterygium. Very very important classification. Type 1, type 2, type 3. 1 is 2 to 4, less than 2 millimeters onto the cornea. If less than 2 millimeters, it is type 1. Type 2 is 2 to 4 millimeters, is type 2. Type 3 is greater than 4 millimeters plus involves the visual axis. Greater than 4 along which involves the visual axis is the type 3. And also we can classify depend on the progressive, depend on this progressions like progressive or regressive. Progressive means thick means increasing, thick fleshy vascular with a whitish infiltration of cornea in front of head of pterygium. In front of head of pterygium we can see some spots called fused spots or islets of Vogt. It's called cap of pterygium. I discussed cap means just in front of the head. So if you in front of that like cap of pterygium, when there is, you can see fused spots. So it is called progressive pterygium. Progressive pterygium. What is regressive pterygium? Progressive pterygium is thick fleshy vascular. It is thick fleshy vascular with a whitish infiltration of cornea. Cornea undergoes whitish infiltration, but it is thick fleshy vascular whitish infiltration of cornea. It is the progressive. It consists of fused spots. Fused spots generally present on the cap of the pterygium. What is regressive pterygium? Regressive means it is a thin atropic, no cap, but Stocker's line. Stocker's line is present iron deposition. So it is a thin, progressive is thick vascular, white is deposition, white is the infiltration of cornea, it is thin atrophy. Regressive is thin atrophy, no cap is present, but Stokes line is present. Stokes line is present, and iron deposition we can see this Stokes line. But here at the cap of the terism we can see the foot spots, islets of Vogt, Vogt. So they classified based on the types and depending on progression. Type 1, type 2, type 3. Less than 2 millimeters, 2 to 4 millimeters, greater than 4 millimeters, plus visual axis also inverse, depending progressive and regressive. This is the thick vascular, thick fleshy vascular with whitish infiltration, whereas thin atrophy. Here a few spots are present at the cap of the terism. Here a Stokes line is present, no cap is present. Okay, depend on this. Next we should discuss about the complications like neoplastic infection and cystic degenerations. Neoplastic is epitheloma, fibrosarcoma, malignant melanoma. Should remember, like neoplastic, any infections or cystic degenerations occurs because of this terism complications. Next we can know about the treatment, like medical treatment and surgical excision, not incision, excision, surgical excision, medical treatment, surgical excision. Okay. First, what is a medical treatment? Medical treatment has three triad. Triad is, first one is because of the discharge, we can use the tear substituents, regressive terism for dry eye. If there is a regressive terism, because of this dry eye, we can use the tear substituents. Like artificial tears. Next, we can use protective from UV rays. We can use the sunglasses, topical steroids for inflammation. If there is any inflammation, we can use steroids. So we can use steroids, tear substitutions, and sunglasses for this medical treatment. For this medical treatment we use three. So you should remember, for treatment, what is the terism, we can use three, like artificial eye drops. We can use what is that, sunglasses, and topical steroids also used. Okay, next, excision, surgical excisions are the three are present. Indication of where we can use this surgery, is cosmetic disfiguration. If there is any eye disfiguration and visual impairment, if there is any visual impairment like regular astigmatism and irregular astigmatism, and if there is a diplopia, then we can do the surgery. When you can do the surgery, the blurring of vision means vision is impaired, it leads to astigmatism and diplopia and cosmetic disfiguration. In these three condition only we can undergo surgery. And if any smaller condition, we can use the medical treatment like sunglasses and steroids and topical eye drops. In these three conditions, we can use a surgery. Okay, if the recurrence of terism, other surgeries are present, like surgery excision with lamellar keratopathy or lamellar keratoplasty. Take the cornea, remove the cornea, keratoplasty or keratopathy, corneal plasty, lamellar keratopathy and keratoplasty. Next, amniotic membrane graft with mitomycin C. This is the important one. For any recurrence, we can use AMC mitomycin C. AMC means amniotic membrane graft. We can use the graft, amniotic membrane graft with mitomycin C. Or any autograft with free conjunctival limbal autograft, CLAG, CLAG. CLAG means conjunctival limbal autograft. We generally, for terism, we can use the graft. For recurrence, we can use CLAG or AMC. More for recurrence, we can use the AMC recurrence. Normal graft means CLAG. CLAG means, what is the CLAG? Conjunctival limbal autograft. CLAG. Conjunctival limbal autograft is present, and amniotic membrane autograft with mitomycin C. These are the recurrence surgeries, AMC and CLAG, and keratopathy and keratoplasty, lamellar keratoplasty. Next one is for older methods, some methods is called MC Reynolds operation. For older method, transplantation of terism in the lower fornix. By using the lower fornix, terism undergoes transplantation normally. So this is the recurrence of terism Treatment, recurrence of terrorism treatment. Next we should how the treatment is occur, how the surgery steps. First take that eye and clean it and expose with universal eye speculum. Use the speculum and expose the eye. Then see the head of the terrorism lifted and dissected over the cornea. Take that terrorism head or dissect over the cornea, and mass of the terrorism separate from the sclera beneath and conjunctiva and above. Then after the we dissected over the cornea, next take from sclera and separate from sclera and conjunctiva also, beneath the sclera and conjunctiva above the conjunctiva, beneath the sclera, and dissect it to separate it. Then terrorism tissues exist. Next terrorism tissue is removed by hemostasis, a cautery of episcleral tissue. To stop the hemostasis, we can use the cautery of episcleral tissue, and free conjunctival limbal autograft takes place. Free conjunctival limbal autograft takes place. Okay, first head of the terrorism from the cornea separate, means dissected. Next conjunctival and from conjunctiva and sclera we should separate this terrorism. After the separation of terrorism, we can use the autograft clag, like conjunctival limbal autograft transplantation will takes place. And another one, for differential diagnosis, sometimes they will ask what is the difference between terrorism and pseudoterrorism. Generally terrorism is a degenerative process. I explained in etiology. Degenerative, wait a minute. Degenerative and hyperplastic condition of this conjunctiva is terrorism. So you should remember. So it is a degenerative and hyperplastic condition. But here a pseudoterrorism is inflammatory process. Generally it is an inflammatory, not a degenerative process. And age is elderly, and we can see pseudoterrorism at any age. Site is generally palpable fissure at any site. And stage is progressive, regressive, and stationary stage. We can see progressive or regressive or any stage. Always stationary stage is present in pseudoterrorism. And probe test can't pass it the underneath. A probe can be passed under the neck. A probe can be passed. Probe, like it is an instrument, can be passed under the neck. It is called pseudoterrorism, which is a terrorism. Okay, it is a degenerative. So you should remember, like terrorism is a degenerative, but pseudoterrorism is an inflammatory. It occurs only at any age. Pseudoterrorism, it only is generally seen at the elder people. It is at site of palpable fissure. It at any site. Probe cannot be passed. Here probe is passed. Next we can see progressive stage, regressive stage, or any stationary stage, but we can only see the stationary stage in this pseudoterrorism. So this is the terrorism topic. It is the most important topic for clinical exams, and like it is also important for theory exams also. So please remember, you should know the concept very clearly about this. You should know the what is that, first of all you should know the classification and symptoms and sign, each and everything. Okay, each and everything you should remember, each and everything. And you should also examine the terrorism case in your wards. Okay, thank you. Please subscribe my channel and please support me. Thank you.